Good morning, everyone, and welcome back. We had a power outage, and those of you who just joined, some of the key update include from Theresa that we have 23 new cases with no new death in our community, and the drive-through testing begins today at 10 o'clock and will be in Windsor at Silver City. Anyone who is over the age of 12 years and older can go to the drive-through sites and get tested. For the testing, we need your name, date of birth, address, contact information, and your health card number. The test site will be up there for the next until Sunday. So going back to our presentation again, thank you for joining us again after the power glitch. Since the beginning of this COVID-19 pandemic, the staff at Windsor-Essex County Health Unit worked tirelessly to protect and promote the health and well-being of our community. The decisions and recommendations made by public health always considered the safety and well-being of everyone. The focus of each and every recommendation was to ensure that the recommendation is based in the best interest of the community and would not lead to any unintended consequences, and it's based on evidence. Since the beginning of this pandemic, we know that there's a lot of misinformation out there, and if there's confusion in the messaging, it could lead to behaviors that can put individuals at risk. I therefore request you to please follow credible information and avoid any misinformation. In addition, thanks to our great partnership with Windsor-Essex EMS, we have started random testing. The data that we will collect using this approach will help us paint a better picture for our community. We'll now move on to the Epi Summary for this week. Okay, so very quickly once again, this is what we will cover in our presentation, and I'll focus on the key points to answer some of the questions that we try to answer every week and see what is happening in our community. The Epi curve help us to assess the progression of the disease, whether we're in the community or in any type of outbreak situation. This particular Epi curve is created to show the number of confirmed cases by symptom onset date. On your vertical axis, you have the number of confirmed cases. On the horizontal axis, you have the dates of these cases started showing symptoms. The significance of using symptom onset date instead of the case reported date is to get a sense of when the disease transmission or exposure happened. This includes all cases, for example, cases in the community, cases in the long-term care home, retirement home, and cases in the agricultural industry. Please note that the data presented in the shaded area may not be reported yet to public health and may not be entirely accurate and subject to change. While we're looking at these Epi curve, day-to-day variation can vary significantly, and we know COVID-19 do not cause disease immediately after exposure. It may take up to 14 days to show symptoms. In order to minimize the impact of day-to-day variation, another way to look at the Epi curve is to present a 3-day moving average. A 3-day moving average should capture day-to-day variation and will try to paint a much better picture of when the transmission infection is starting. We can see that roughly since second and third week of April, the number of confirmed cases is going down and moving in the right direction. In early weeks of May, we notice a further decline in the number of cases. We have seen some day-to-day variation in the number of cases this week, and I will be curious to see the data next week to see the true impact on the 3-day moving average. Please note that the data presented in this shaded area may still not yet be reported and may not be entirely accurate and subject to change. This particular figure shows how we have been doing with the outbreaks in long-term care home and retirement home, and the blue bars indicate the number of facilities and homes that are currently in an outbreak, while the green bars state when a new outbreak was declared in a long-term care home. Please note that this will not add up to 18 as the number of long-term care home, because the date a home is rescinded may conflict with when the health unit was reporting an existing outbreak. This graph shows retroactively to corrected those numbers. The next logical question comes to our mind is, are we seeing something really bad? Should we be worried? How are others doing? At this point, Windsor and Essex County has the third highest rate in the province, and our rates are higher than the province. We have experienced a higher proportion of cases in long-term care home and retirement home, currently 32%, and its peak was 42%, including staff and residents. We are also seeing an increase in the number of individuals in the agricultural sector who are ill, up to 15% of our cases. Windsor-Essex is home to a large number of farms, which is contributing to the number of cases we see, with an estimated number of migrant farm workers close to 8,000, anywhere between 8 and 10,000 people. The next question that comes to my mind is, how are we doing about the testing, the overall percent positivity since the beginning? We started off, it is currently now is at close to 5.4%. While we saw a decrease in testing last week, as we approach the end of this week, we are seeing an increase in the tests being done in the community, and we expect to see that number go up based on the random testing that we started today. We've been asked how it takes for us to receive our lab result back once we conduct a test. This figure shows, look at a turnaround time when a test was done to when it was received, and specifically if it was received within 1 day of testing and 2 days of testing. More recently, we are seeing a better turnaround time within 2 days or receiving a test, while early on there was quite a variation. We've also have to note that priority testing could also result in why certain days were higher than the others, depending on the test where they're coming from, and if they're coming from the hospital or individuals who are looking for clinical care. Looking at the past 3 weeks, we've been investigating 100% of our case, which is the green bar within 1 day of it being reported to the public health. And this is one of the indicator or metrics that we use to assess our case and contact management. And if we are able to reach out to the case within 24 hours, that allows us to get on top of things to ensure that a good case and contact management is being followed up across Windsor and Essex. So we present this data to show the age and sex distribution. What our Epi team noted is there is a shift in the age group that is now moving more positive cases, and we did a sub-analysis on that. Since May 8th, the new cases are significantly high between the ages of 20 to 39 years. A good number of them are healthcare workers and probably had a higher chance of exposure to COVID, but for anyone in that age group, the public health message is the importance of physical distancing, appropriate hand washing, and appropriate respiratory etiquette are very important. You are also at high risk, and the numbers show that, so please take precautions when you're out there. Now, looking at the distribution of COVID-19 cases by municipality, over the past few weeks, we have seen a little change in the number of cases across the municipality. Windsor continues to be the top municipality with 55% of the cases. However, over time, we're seeing these cases are switching into the county, specifically in Kingsville and Leamington. Kingsville had a number of long-term care homes that contributed to the number and the proportion of cases in Kingsville, and now in Leamington, which is increasing. It's all because of the agriculture farm industry. The majority of them are in Leamington. Same caution I would like to request with all the residents in Windsor and Essex. So please do not feel that if you are in one of these municipalities, you would be at a higher risk or at a lower risk. The risk is pretty much everywhere. We have to practice all the public health measures irrespective of where we live. That is the best way to protect yourself from contracting COVID and spreading it further to other people. Through the extensive contact tracing the health unit is carrying out, we are able to identify the majority of the exposures as close contacts. This can include close contact in a household, long-term care home, retirement home, congregate settings such as shelters and migrant farms. This also shows the impact of our measures. If we can track down most of the cases to a close contact, that means we are reducing the community spread. If you look at the cases in the last few weeks, most of these new cases are happening in close contact, with the exception of one particular day when we had more cases as a result of community transmission. This particular graph look at the breakdown of the data cases from healthcare worker status, and roughly around 24% of the cases in our community are in healthcare worker, and a good number of a good proportion of these cases also went to Michigan, and could be healthcare workers working in Michigan. Another question that is frequently asked is if the cases had any underlying chronic conditions, and roughly 30% of the cases had some medical condition, whether it was chronic, underlying, or if they were immunosuppressed. A quick look at the cases and what symptoms they are reporting. Still, by far, the most common symptom that people are presenting it is with cough and fever, and anyone with any of these symptoms, even one symptoms, are now able to get tested either at the assessment center or through our random drive-through test site that's available in Windsor today. So this particular graph shows the number of hospitalization and patients in an ICU on any given day. It includes both new patients as well as existing patients with COVID-19. Cases in the ICU remain relatively low for the past couple of weeks at approximately 3 or so cases. This past week, there has been only one individual in the ICU with COVID. The red line indicates the 7-day moving average in the ICU, showing a decrease and a trend in ICU. Hospitalization have fluctuated more than the ICU, but we are once again seeing a decline in hospitalizations related to COVID. This particular slide depicts the capacity of our healthcare system in Windsor-Essex. The orange line highlights the occupancy rate of our acute beds. The threshold is to have the occupancy rate be below 85%, which are currently meeting. The signals that we are currently able to meet the demands related to COVID. From an ICU capacity perspective, we look at the overall ICU capacity and ICU ventilator beds. While there is no established thresholds, overall we are aiming to be less than 50% for overall ICU bed occupied. Higher than this may lead to stress to the healthcare system if COVID-19 increase in our community and the need for these ICU beds and ventilator increase. So where we are with all these cases, a good majority of them, more than half of them, are resolved. Unfortunately, we lost 7% of our cases to COVID, and we'll continue. Approximately 25% of the people are self-isolating, and between like 1.7% and 0.1% individuals are currently in ICU getting care. Looking at the age and sex breakdown of COVID-19 deaths in our community, overall we can see that more female died with COVID compared to male, and from an age distribution perspective, almost 3/4 of the death was in individuals who were 80 years and older, and the youngest person who died was a male in his 40s. From a case fatality perspective, this particular graph shows that anyone who contracted COVID in our community, the case fatality rate was approximately 6.8%, which is a decrease from last week. And those who are living in the long-term care home, case fatality rate was significantly high, up to 16% in this particular age group in Windsor-Essex. As of May 27th, the case fatality rate in all of Ontario was 8.1%, which is higher than the provincial average, which is higher than the Windsor-Essex County. In the long-term care home and retirement home across Ontario, the case fatality rate is also higher compared to the Windsor-Essex County. This number will vary depending on how the Ministry and Public Health Ontario provides their data. The doubling time tells us how many days it will take to see twice as many COVID-19 cases in our region. It tells us how quickly COVID-19 is spreading in our area. This particular graph looks at our doubling rate since our first case was reported, and currently we are past 5 days, considering in late March and early April we were doubling every 2 days, and it shows the impact of flattening of the curve very clearly in this particular graph. The general direction we are moving in as a country, province and locally, is pretty good. We see variability in the number for our region due to small number of cases relative to the entire province and the entire country. Based on the trend and current doubling time, we are better than the province and the country, but again, these are day-to-day comparison, and it's not an overall comparison over time. Our doubling rate has been generally been higher for large parts of the pandemic, even though our case counts have relatively high compared to other jurisdictions in the province. So R0 is the measure that basically shows the transmissibility of the virus. If one person contracts the disease, how many new cases that this person will generate. The most recent estimate that we calculated for R0 is 0.96, which is very close to 1. When the R0 is less than 1, each existing infection can cause less than one new infection, and eventually from the overall look perspective, we will eventually get to 0 case if it's less than 1. We're just above that number or close to that number with an R0 of more than 1. If that's the case, we will continue to see existing infection causing more new cases in the community. We did see an increase in the past week with our cases, probably around the Victoria Day weekend timeline, and that's evident in our effective calculation of mean R0. And now it's trending down back to where it should be, below 1 with respect to community transmission. This signals how finely balanced things are related to COVID-19 and how each of these measures and how our action will justify how COVID is spreading in the community. While we are seeing improvement, we need to continue to practice the recommended public health guidelines of physical distancing to further drive this number down. Unless we drive this number down, and if we are taking on risky behaviors, this number will continue to go up and will put our community at risk of further spread, and could pose a difficult question for us to identify what is next with respect to reopening these services, these facilities, and the importance of following the public health recommendations. So in summary, Windsor-Essex continues to see a decline in case count. We have the third highest rate in the province when we're comparing it based on the per 100,000 population. The primary source of exposure is through close contacts with a confirmed case, but we are still seeing some of the community transmission, which we would like to go down to 0 or up to a level which there is limited or no community transmission. Hospitalization and ICU capacity are within the expected thresholds, which is a good sign from a public health perspective that if there is a surge in the cases, the healthcare system would be able to respond to it. But we definitely want to emphasize the importance of doing the public health practice to ensure that we don't get to the point of seeing more cases in the community in the hospitalization or ICU. Our not effective value is less than 1, but it's very close to the mean, with fluctuations seen in the past week, and we'd like to see that the effective R naught value continue to go down to reduce the number of cases, ongoing cases in the community. Thank you.
We'll now take questions from the media. We'll start with the Windsor Star.
Yes. In terms of agriculture workers, can you go over the different responsibilities that the health unit has from the Ministry of Labour in terms of keeping people in that sector healthy?
So there are a multi-level of government involvement with the agriculture industry, starting right all the way from the federal government that has the responsibility and authority to authorize these temporary foreign workers to come and work in these farms. The cases that we are seeing is not only in the temporary foreign workers, but a significant number of cases that are local residents, but work in that industry as well. So starting all the way from the federal government in terms of what regulations they set up with respect to who's coming and what the requirements are for them to come and work in that industry, all the way to putting restrictions and requirements from the employers with respect to their accommodation. The employers are responsible for their accommodation. The employers are responsible for their transportation, and ensuring that if a new worker is coming into the country, they are meeting the 14 days quarantine requirement for that particular reason to avoid anyone bringing new case to the community. Once they are in these accommodation or in these quarantine sites, The public health and the municipalities have a role to inspect and ensure that all these places meet the requirement and the standard for housing these individuals. Most of these individuals are coming in from a country with a different social and cultural background, with a lot of challenges in communication, understanding, language barriers, and social cultural differences. But despite that, we provide all kind of translation services, all kind of support to ensure that our public health messaging is going on there. Once they complete their quarantine requirement, they go back to their workplace. Each of these agricultural farms that we are talking about, it is a workplace. It is not something that is managed by any level of government. These are private workplaces, and the ownership and responsibility of all these workplaces is to ensure safety and well-being of their employees based on the guidelines that is provided by meeting some of the federal government requirement as well as the provincial government requirement to maintain a safe and healthy workplace, just like any other workplace in the community or in the province. When it comes to the case and contact management, if there is a case, whether we're talking about a non-agricultural farm, non-agricultural sector versus an agricultural sector, the case and contact management follows the same principle. We connect with the case, we ensure that they are self-isolating, all their cases, all their contacts, high-risk contacts, they are also self-isolating. And then we are following up with them to ensure that if any of them need more testing, if we need to expand the testing based on the risk and based on the type of exposure, we have done all of that in terms to ensure that all these case and contact management is being followed up. Once we identify who need to be isolated and who need medical care, so all those efforts are being made from our end as well as the employer. When they are screening all these individuals to come into the workplace, they are asked if they see any symptoms, and if there is any assessment is needed, they are sent to the assessment center where they are assessed by the healthcare provider at the assessment center and appropriately tested with the instruction to go home and self-isolate. And then once they get the positive results, we immediately get onto it. We make sure that all the contacts are identified and they're all self-isolating. The employer's responsibility, along with the ministry, is to make sure that all these people who need self-isolation, they are self-isolated, and majority of those individuals are self-isolating in the hotel motel in the region. If there are more cases or more exposures in one particular shared accommodation, all these people, if they need self-isolation, they're all self-isolated in that setting. Just because of the logistics of how many people are in there, and if all of them are high risk or if all of them are cases, so they're doing the isolation on that part. So our role from a public health perspective is to make sure that all these things are being in compliant with respect to case and contact management. We noticed some challenges with these farms with respect to people working in different farms and some of the other issues. As a result, we issued an order on all these agriculture industry to ensure that we are able to follow up with all these individuals that we need to ensure that we are not letting these people or letting these individuals spread it to others, and all the good appropriate public health precautions are in place to do that. And in cases, we have issued Section 22 order, which limits and restricts individuals to do certain activities to ensure the safety of the community, and that has been also done. Any kind of work-related issues or work-related exposure or risk at the workplace, this is the Ministry of Health. They do their inspection, their responsibility to ensure that the workplace is safe for all the employees. So there are multiple levels of government involved, and our role is very critical in terms of case and contact management, or in case if we identify if there's a cluster of case or if there's any outbreak happening, we manage that, and we've been doing that so far, and that's why we're reporting all these cases. And even the spikes that we are reporting, these are all close contacts, meaning they're all linked to most of the time with shared accommodations. These individuals share homes, sometimes 12 to 15 people in one house, and if one or two of them get a case, guess what? Everyone else is getting the case too. So you can easily see that number multiply, and based on the current legislation, based on the current law, they're all meeting that, but you cannot change human behavior that easily, and to just continue to hammer in the same message to follow the public health guidelines, which we continue to do.
Has the health unit had to issue any of the $5,000 fines since issuing that order?
Not at this point, but if any of these violations occur and we feel that we need to do that, we will do it.
And can you give us a sense of how often public health inspectors are going out to these facilities to inspect?
So these shared accommodation, that is the responsibility of the public health unit to inspect and ensure that there are safe living conditions in these facilities. The workplace is a workplace. We do not inspect workplace unless there is a very specific concern that is identified. The Ministry of Labor, that they go to each of these farms and even like if they have one case. So any single case will trigger a Ministry of Labor inspection to this farm to ensure that they have good practices happening at the farm to protect the employees and keep the workplace a safer environment.
Thank you.
Any questions from CBC?
Yes, good morning. First, I had a question from someone asking what exactly the random testing was showing. Is it just if they have coronavirus or not that day?
Yes, is the case. So if we are looking at the spread when more and more people are outdoors and are spending time outdoor, and now if we have the capacity to test on those individuals, what this would do is it would tell us the people not following through a self-selection bias of going and making an effort to go to the assessment center and get tested because either they have a concern or maybe they feel for any reason that they want to get tested. The idea behind these drive-through testing is not to identify those people who are really interested in getting the test done, but have a broader mix of population, anyone and everyone. And that way, when we use the statistical analysis based on the sample size calculation and everything, we can say with some kind of a certainty that if we're looking at a general population, what does it look like? If it exists in a higher number or a higher proportion of population, these cases, or if there's not enough or not many cases in the community. So it will help us answer some of the very specific question, and that is why it is very targeted with a goal and with a target to ensure that we are capturing an appropriate number of people in the community to help us make further decision with respect to what is happening in the community and the community spread.
I have questions about the emails between you and David Mouche. First, why did you refuse to allow the paramedics to do testing at nursing homes when other paramedics were doing the same thing in other parts of the province?
So I think if you have a specific question on that email, I would decline to answer because I don't think that this kind of personal communication is something that I should be allowing myself to answer. If you have a specific question in terms of the public health rationale, I can give you a number of rationales, which I've been saying consistently in all my media messaging every day, and I think you are part of many of those conversations, even the value of testing and the validity of the testing and what this testing has shown. As far as the EMS role is concerned, I do recognize that they are an important partner, but when we're talking about all these long-term care homes and retirement homes, you have to understand that all these long-term care homes are denying access to all types of visitors. And any essential visitors are like, even at that time, they were not allowed. The whole purpose is if you are introducing new people in the home, you are putting the home at risk of spreading COVID because you don't know who's carrying what. And if anyone who's coming into these type of closed environment, you are putting people at risk. We were the first one one of the few ones who had all those systems in place, ready to go. And the intent of using all these EMS support services is to help the community, which we did. And we took these measures, especially when we got more information, more support, more direction from the government to ensure that all of these work is happening appropriately. So we did that and will continue to do that, always using the evidence, always using good public health science to make decision which is in the best interest of the community.
Between the exchange, there was some words do you think a rift like this could continue and potentially threaten future decisions between both you and the hospital during this pandemic?
Well, I see my role. I am the medical officer of health. I am public health. I'm representing not only just a person myself. I have the whole organization. We have a whole ministry. We have a whole ministry guidelines. We have specific protocols. We have specific guidelines, and we will continue to follow those guidelines. If anyone has a different opinion, which is not in a public health interest or in public health direction, I would question that if they have the ability to do that, or if they should be making those recommendations. There is a specific structure system in place, and all of those are based on evidence. All of those are based on public health science, and public health science has been very clear, and our messaging has been very clear right from the beginning. I am here always answering these questions, and I have done that to ensure that everyone is aware of what is the direction. There's a lot of misinformation. I've always said that. And any of these confusion, it is not good for the community. My recommendations, my approach, our health unit's approach has always been evidence-based, and it relies on the evidence. It follows the guidelines, either from the ministry, public health guidelines, best practices, and all of those are written very clearly and very clearly laid out, and anyone who will make the effort, they will know where these recommendations and guidelines are coming from, and we'll stick to that, and we'll continue to do that.
Thank you.
Any questions from Blackburn?
Yes, just you were saying about your responsibilities for the shared accommodations for these agri-farm workers. Have you personally been out to these accommodations, and how do you feel the farms are doing, or the employers are doing to provide these?
So it's a good question. So our health inspectors inspect every accommodation, every shared accommodation. This is part of our responsibility, even when if any of these individuals are required to go in self-isolation. Our inspectors are out there to even ensure that wherever they're going for the self-isolation, it meets all the requirement and safety requirements as per the legislation. So we do that, and we'll continue to do that. And so I'm not sure, maybe we have done hundreds and hundreds of these inspections in the last 2-3 months. And as more cases are coming up, we are doing additional inspection based on where these individuals are going for self-isolation. So this work is an ongoing work, and our inspectors are there all the time if every time a new accommodation is identified.
Any questions from AM 800?
Yeah, a couple of questions. Maybe you've covered this, but you're obviously naming the long-term care homes who are experiencing outbreaks. So why aren't you naming, all of the farms and agri-sector places who are also experiencing some of these cases?
Going back to some of our other requirements, there is a specific requirement from the ministry to put all these long-term care home and retirement home as a disclosure, part of the disclosure practices, similar to what we disclose for every restaurant and that we inspect and put our disclosure notification. Under the legislation, there is no such requirement to post these, and obviously for good reason, because these are private businesses, and they are under the privacy law. We cannot disclose many of these things unless we feel that there is a risk to the community, and unless I can prove that risk exists. Under the privacy law, we cannot share that information, and I feel it would be irresponsible to target any particular farm or any industry where the issue is not linked directly to the business, but more on the practices of human behavior. And if there is any evidence that one particular industry is at risk, or employees who are working there at risk, we will be the first one to notify and take appropriate action to either close the business down for further investigation or take appropriate action to contain and limit the spread of the disease in that particular industry.
And obviously, these places are handling food in many different varieties. Is there any risk to the food and things that are being handled and to it spreading in the community that way?
So some of this information is also available on our website. To date, there is no evidence to suggest that COVID-19 is spread through contaminated food. COVID-19 is a droplet disease, and it's spread through the infected person who has spreading it through the droplet route. And unless that happens, the risk of infection is pretty much low to none. So there is good evidence from many credible public health agencies to say that food is not the source of transmission of COVID-19 anywhere in the world.
Okay. And obviously there's been quite an increase in the number of tests being done since, the testing was opened up to anyone, really. Do you have any indication of how many of the tests are coming back positive in people who showed up for testing saying that they were asymptomatic?
So we will be looking at that information very closely because, again, using the evidence-based practices is a good thing, and we will continue to do that. And we like to take all the opportunity, whether we feel that it's something that is a direction from the government or not. We like to make the best use of it. So if this is what it's happening already, we'd like to look at the data, and we'd like to provide evidence even for the rest of the field and to the group to see how it matters or not. Based on the data that we have from all the testing at the long-term care home and retirement home, I know some people are throwing in different numbers, but again, going back to the science, going back to the evidence, what has shown in the long-term care home and retirement home in our region, where we tested more than 4,000 people, it's a lot of people. So we tested 4,000 people, residents, and we had 0.9% positivity in the asymptomatic individuals in all these homes. And just by the sheer possibility of false positive, we cannot exclude even the 0.9% is a false positive or a true positive. But that's the evidence. The other evidence, if you extrapolate it from the asymptomatic staff working in these facilities, which is again in excess of more than 2,000 people, the evidence is 0.4% positive cases in asymptomatic staff. Again, there you go. You have to look at it whether it's a false positive or whether it's a true reflection of asymptomatic transmission happening. So we have all those data, we have all those evidence, and the recommendations and what we have been using, our public health decision making will always be and has always been based on the evidence and based on the data.
Okay, thank you.
Any questions from Windsor?
Yes, a few weeks ago you had mentioned Health Canada had approved antibody testing. Do you have any updates on that or how that's being rolled out to areas such as ours?
Question, and I am as anxiously waiting, just like anyone else, to see how and when it becomes available. We have ongoing conversation with labs with respect to lab capacity and the policy updates that the lab do. Unfortunately, we haven't heard any further information on where we are with the antibody testing. The last I heard is right now they're doing some calibration study to ensure that whatever they're reporting is accurate and can be used for meaningful to draw meaningful conclusions to it. But I am with you. I'm as anxiously waiting for those antibody testing, and I'm also waiting for the point of care testing, because I know that there's been a lot of talk and interest in testing, but you cannot use a wrong test to answer a question which the test is not designed to answer. And if we are really looking at the scale and magnitude of how these testing should be used and how these data should be understood by the community, for any type of decision making, you need all of those. Point of care testing, which I believe most of the people should be using, especially if they work in an industry which is an essential industry and day-to-day testing is important for that industry. That's the test that we need. Unfortunately, we don't have that test available. We only have a diagnostic test, which is the nasopharyngeal swab, which just by the nature of the test, it shouldn't be used in that manner, because what is happening is, again, going back to some of my previous comments, it is causing some people to believe that once you're tested negative, you are fine, and that's what the result that we are seeing. Even in the conversations about these homes, long-term care homes, many of these long-term care homes, or at least some of them, they're interested more in testing rather than going and putting their focus on the infection prevention and control measure. Because unless you do a good infection prevention and control measure, you cannot contain the infection, you cannot contain the spread, and the focus and attention should be there. As human being, as human behavior, we like to go with the easy thing. It's not. These tests are not designed to give you the answer that people are looking. So please do not lose your guard and always practice on following some of these recommendations, which are important and crucial to limit and contain the spread of the disease.
Any questions from Radio Canada?
Yes, thank you. So I've been told by organizations who work with migrant workers that several agricultural companies don't respect health measures to protect their employees from getting infected. For instance, they say that some migrant workers still live in overcrowded houses. So my questions are, did inspectors notice any problems with meeting health standards?
So all the homes that we inspect are the identified home where all these workers are put in place by their employers. So that's how we are aware of these homes, with all these documentation and proofs of who is working where and which accommodations that they are working in. So that's our role. If there is a home with people who are not part of any farm or who are not part of any program, either through the federal government or through any other program, if they are there, I guess that could be an issue from an overall enforcement perspective. That who are these people, why they're living there? It's not necessarily comes back to the idea by default that we will be aware of this. If these are the case, I think we need to have that conversation with the municipality and all the other appropriate agencies to ensure that every law that all of us follow is being followed, and ensure the safety and well-being of not only those people but also for the community. So I'm not aware of any of these homes, but if there are, we'll have to have that conversation with the appropriate municipality to ensure that we are bringing in all these stakeholders to do the follow-up and take appropriate action.
Could this inspection be done over the phone, like for the long-term cares and retirement homes?
Don't do that. We have always been on the ground, and even in all of these outbreaks, our inspectors are out in these long-term care home and retirement home the very next day and do a good thorough inspection and do all the infection prevention and control education and practices. Maybe many people are not aware of that, but this has been our role since the beginning, and we've always been doing that, and nothing that we advertise it, that we are doing it, but that's part of our role, and we've been on it since the beginning, even before any of these outbreaks hit these facilities.
Have there been any reports, and who's making the reports, and can we consult them?
I'm not sure what kind of report are you referring to?
Inspectors' reports showing a lack of respect of health measures.
As I said, most of these reports are educational in nature, and what we try to do is we provide that support in terms of managing the outbreak, act as a consultant and as a resource to the facilities to provide them with the right advice for infection prevention and control measures. Those reports are available, but there is no such so far requirement to share that report. But if anyone is interested, maybe we can look into it, that how we can make that reports available. But those reports are for a very specific reason and are very focused onto our role as the public health inspector, and that we do. It could be very different from the long-term care home inspector or retirement home inspector with very specific guidelines and mandate to do the inspection.
Thank you very much.
Any questions from CTV?
Okay, going back to the email, I'll make this quick and painless. When it comes to decision making, are you confident in the decisions that you and your team have made throughout the pandemic, and in terms of testing the LTCs?
I'd like to not to comment on those specific, but what I can tell you is you have to look at the role of public health and how public health system work. There is very specific criteria, very specific requirement for public health and the role of public health, and even the role of medical officer of health. The medical officers of health have to go through extensive training to be in the position that they are entrusted to be. It's not a political position. It's a position based on the need and the expectation from the medical officer of health. It's a recognized Royal College specialty that people have to go and study for 5 years post their MD training to get the title of public health specialist. So there's a lot of training and background that goes into it, and it's always just like any other type of scientific specialty. It's evidence-based, so that's what we follow. All our staff are also, some of the key staff are also identified under the legislation with specific requirements of what qualifies them to do the job of what they're doing. So all these are very strict, very clearly identified. We have Ontario Public Health Standards that guides us with the role and the work that we do and how we do it. We have Public Health Ontario, we have ministry guidelines, we have ministry protocol, we have Public Health Ontario protocols, we have Public Health Agency of protocols. We have got a good scientific body that support us to do our work. And in some cases, as a physician, so the good analogy is if I'm a physician, if I'm treating someone, I do an assessment and I make a recommendation based on the expertise and the training that I have received to make a recommendation. You may have some, a different opinion from a different physician, which I'm happy to listen and then act in the best interest of the patient. So same idea, if I'm a public health specialist, my patient is my community. And I know how to assess the health and well-being of my community, which we do using different techniques, different data analysis, different type of active investigation that we do all the time to make a diagnosis that what is needed. And then based on that, I make a treatment recommendation that this is what needs to happen. So there is a thought process that goes into all of that with training and with a specific education that helps me to make those decisions. So I feel completely confident in my staff ability. Obviously, I don't want to comment on my own ability. I think that's everyone else to realize. But I fully trust each and every employee of mine that they are doing their best and they are all trained and qualified to do the job, every job that they're doing. And I have no concerns on that. And everything that I'm following and I'm presenting for myself, it's out there in front of the media, in front of everyone, and we've been doing this for more than 2.5 months. Every day I am here. Every day I am, my messaging and my position has been consistent, always been evidence-based. I'm not just going based on what someone is asking me to do or someone is telling me to do. I am making the evidence, I'm using the evidence to make the decision in the best interest of my community, and I'll continue to do that. And I wouldn't get distracted in these type of personal comments or personal issues that some people feel that it's important for them to bring out. I don't.
Okay, so having said that, should residents of Windsor-Essex be concerned that from time to time, the Chief Medical Officer and the CEO of Windsor Regional Hospital don't see eye to eye? Should we be concerned?
Well, I guess I would just say that again, going back to what my expertise is. My expertise is public health. You ask me any question about public health, I'll be gladly answering this question. I wouldn't even try to comment on how do you your job as a journalist or anyone else, because that's not my training, not my expertise. So I think I should limit to what I know. I know public health, what I am doing, and this I will continue to do that. I guess I cannot stop anyone from making any comment or suggestions, and it's entirely up to them. We live in a free society. People can do that. I know my role, my board knows my role, and the public knows my role, I think most of them, and we will continue to do the job. So that's my job, my focus. I'm not interested in how people are looking at me, especially if they disagree with my opinion or my expertise, but I do have the background. I do have the evidence to support everything that I say and everything I do, and will continue to do that.
Any further questions from the Windsor Star?
No, thank you.
CBC?
No, thank you.
Blackburn?
No, thank you.
AMA 100? Windsor?
Hello?
No, thank you.
Radio Canada?
Yes, please. So the random testing are beginning today?
Looking at my clock, so it should begin. It should have already begun. We plan to start at
10 o'clock, so it started today.
Okay, where can we? Where is it located, please?
It is currently located at the Silver City at Walker and Provincial Road.
Thank you very much.
Questions from CTV?
Have a nice weekend.
Thank you.
Thank you.
Thank you.